Hi, this is Dr. Renee Watts. One of the most frequently asked questions that we get is why do I need dental x-rays and how often? So we'll talk a little bit about that today. Now the why is that many diseases and conditions that we get as humans, both in our mouth as well as throughout our body, we may not feel any signs or symptoms of until they reach their advanced stages. Sometimes people think that if they have cavities, they'll feel some type of sensitivity. Sometimes they do and sometimes they don't. So just like, for example, heart disease, diabetes, high blood pressure, even cancer, oftentimes we're not going to feel symptoms until they reach their later stages. And so what x-rays do is help you and your dentist pick up problems in earlier stages, lets them be treated more conservatively, less expensively, saving you time, money, and discomfort. So to go back to the medical analogy, just like if you go to your medical doctor, they're not going to be able to tell looking at you if you have many conditions. They need to do some blood work, take your blood pressure, get a little bit more information. And that's what x-rays do for us. X-rays are still one of the most cost-effective and best ways to determine problems that are under the surface. So to give you an example, in this photo here, this tooth looks pretty healthy, and this lady had no symptoms with this tooth, but the x-ray showed us that there was a small cavity in between the teeth. So as we go to treat it and take away some of the enamel, then we can see the decayed area that is in between the teeth, and we were able to treat this tooth with just a simple filling. So dental x-rays are very low dose in terms of radiation. A set of dental x-rays is equivalent to about 1 day of background radiation. What that means is maybe an airplane ride for an hour or two will give you about the same dose of natural radiation that you would get from the sun. With the dental x-rays though, you get the great benefit of knowing exactly what the status of your mouth is. Now the frequency that x-rays are going to be recommended is going to again be depending on your own personal history and your risks. Someone with a history of more cavities, who's had more work done, more problems, are going to be recommended a little more frequently than someone with a history of fewer problems. Additionally, if people have other conditions, say a dry mouth or diabetes, they may be recommended more frequently. As we know, those people are at higher risk of having some problems. There's a great tool online that you can use at www.xrayrisk.com that talks a little bit more about medical imaging and radiation of all types, and there's a tool there where you can go ahead and put in the history of all kinds of tests that you may have had throughout your lifetime and calculate your own individual risk. So your dentist can help recommend what's going to be best for you. If you'd like any more information, you can click any of the links below. Thanks for watching.